Hey everybody. Well, here we are again. Can you even believe the month of May? And here we are with the check in with our monthly IG chat that I have with my good friend Charlie Red. And I'd like to be able to make sure I send out some invites. Second here. Okay, I'm sending out the invites right now. So we should have a awesome conversation today. Really good chat. So with that being said,
Can you see me?
I can hear
You
you.
can't see me?
Um,
Okay,
Give me a second here.
okay,
I'm requesting to go live with you right
okay.
now. Now, did you see the invitation, Chuck?
Yes, uh-huh.
Okay, let's see. Well, you know what, Chuck? I'm trying it. I'm here.
I think you're the only one who can't see me. Marilyn can see me.
Okay, can she?
Yeah, uh-huh.
Oh boy, here we go with this again. I don't understand that. I
Well,
have no idea why that is.
that's why we do it early for those very reasons. So yes.
Okay, as long as Marilyn, can you see Charlie, or can you just see me if you could respond? I'll wait for the response
Mhm.
here.
Both?
Okay, okay. If you can see, then great. Now let's see what happens
We try to
when
get
our
Pam in.
special guests come on.
Yeah.
Okay. Okay. So for the meanwhile, again, for anyone that is watching this, and I was saying prior to having my cohort in crime jump on, this is the check-in with for the month of May. Again, this is now an IG live chat that my good friend Charlie Red and I host every single month, as all of you know, obviously by the timestamp, at 1 p.m. Eastern. Oh no, wait, 12 p.m. Eastern.
12,
Sorry.
yeah.
11 a.m. Central, 9 a.m. for the Pacific Coasters. Boy, I tell you what, a little tired today, so don't hold it against me. But for the month of May, due to the fact that it is mental health or mental, I don't want to say illness, I want to say mental health month, we decided that we wanted to be able to discuss that specifically with some special guests that we're going to have to be joining. Thank you, Sister Shanta. I see that you see both of us. So I don't know why I can't see. That's really weird, but oh well, that's fine. All right. Oh, okay, great. I see, Pam, that you're in the room, but I don't
Yeah,
see
they're on.
you on the screen. So
Yes, send another invite. Please.
I'm looking to see if I can.
Okay.
It says that you're unable to join. I just got a notation that it says you're unable to join. So let me try. Let me see if I can try again here. I'm typing it in to see if it's going to work. Okay, I don't see that that is working. Let's see. Do you see her literally? You see her in the room as well, right, Chuck?
It's let's see, you're talking to, yeah.
So, Pam, or if you say that you are on your phone, can you step out of the room and join again, and maybe that'll re-register for us to be able to add you. Let's give that a shot and see what we got here. Okay. So Chuck, if you just kind of be on the lookout for the conversation in chat, and we'll just kind of keep going for the meanwhile. So again, as Charlie said, the reasons being why we joined early, so that way we can kind of work out some of the kinks. So with that being said, mental illness is the topic of, I'm sorry, mental health. I want to make sure I'm very specific about what I say, is the topic that we're going to be discussing today. Technically, I said to Charlie not too long ago, we want to be intentional. We want to be intentional about some of the topics that we cover, things that are happening in all of our communities, not just us as African Americans. But again, overall, we want to be able to have conversations about what's happening in this world and in real time. And mental health is something that I think has affected each and every one of us, to some type of degree, some varying degree. So I felt like it was really, really important that we take the time to have that
It says
conversation.
she
Now,
needs says she needs another invite. She just wrote in the chat.
okay, I don't even see that her name is in the room. So let me see if
Yes, see what we do. Following.
yeah, I'm not even seeing her name as a participant in the room. And
Okay.
and I know that it can't be because she's on her phone. It has to definitely be because she give
Yeah,
me a
because
second.
she's able to text, so I'm seeing the feedback in the chat. So obviously she's definitely
Let
in
me
the room.
see. Let me see if that worked. I just
Okay.
I just sent a go live.
Okay.
So and you'll have to tell me if you can see it because I'm only able to see me at this point. It's not showing me everyone.
Okay.
Do you see that she's joined yet?
Not yet.
Let's see.
Because there are 5 people. Okay.
I'll try again here.
Yeah, because Keisha, Dr. Wilkes says she's watching, so she's definitely in the room as well. Let's see.
Okay. I actually just pulled over Dr. Wilkes. Again, please tell me if anyone pops up on the screen because, again, I can only see myself.
Yep, there
Well,
she
now I can
goes.
see Dr.
Yep.
Wilkes.
Okay, so we'll put this
There
on.
we go.
Oh, good.
You know what? This seems to happen every single month. We have some type of issue that actually happens. Were you all trying through your phone or through the laptop this
We'll
last time?
turn to the
Okay,
phone.
Okay.
okay. Well,
Can you see both
then
of us?
we
Yes.
can't.
Okay, perfect.
We can't. So, with that being said, again, if you ladies would give me just one moment, if you would, I was saying to those that are watching, and I will go back up to the top again to say, again, welcome everyone. This is the check in with, this is our monthly, at this point, it's IG live chat that my good friend Charlie Red and I host. We do talk about a myriad of topics every single month. And as I was mentioning, we wanted to make sure that coming into this year, that the topics that we discuss on certain levels were very intentional. It wasn't just going to be surface level, you know, 1, 2, 3 chat type thing. Because again, if that's the case, he and I can pick up the phone and do that. But to invite everyone in to the conversations we do enjoy having, and again, have some conversations that have some depth to them. And with the issues that we have that are going on within our country, it was really, really important that we covered certain things. Again, not just within our community as African Americans, because that's the majority of, obviously Chuck and I are African American, but within all communities. And this being Mental Health Month, it was very, very important that we were able to discuss it. And we now have some young ladies that have joined us that are going to be able to give us some more information on things to look for. Quite possibly some resources, because I think that that's a lot of the time what we've run into is, and strangely enough, and I'm going to get off topic for 2 seconds. I just got off the phone with my kid's godmother. She is the cohort of Charlie because he's my kid's godfather. But I just got off the phone with her, and she's an RN, and she specifically has worked in mental facilities for a number of years. And I didn't think to have her on because she had something else that was going on for this month. But she said, you know what? Great topic, Tanya. It's definitely something that you need to talk about. But one thing I want to make sure that you bring forward is for people to be compassionate with people that are mentally challenged. And what I said to her was the problem is a lot of the times we don't even know. We throw around words, that like they're disposable, like that person's crazy. We hear things like that or say things like that and don't understand that that person actually may have a mental challenge. And we're not, understanding enough. We just kind of throw it out there and we don't take the next step. So that's kind of what I'm going to make sure that we cover this month. Let's talk about some things that we can look for within people that we know, within our loved ones, and then any support that we can provide them, as well as resources to where to go. So, with that being said, ladies, again, I want to take a moment to be able to say thank you for joining us. Dr. Wilkes, again, I hear a lot about you from Charlie. He thinks a great deal about you. So, thank you
Oh,
again for joining.
thank you,
Sister, I'm sorry.
Red.
Uh, Sister Short, I, again, appreciate you. Pam, correct?
Yes.
Okay.
Yes.
Again, I'm just now becoming acquainted with you as well. So again, thank you both for jumping on. So very, very grateful for that. Now, can you two see three of us on the screen or four of us on the screen? Okay,
Yes.
great. Wish I could see you, Chuck, but apparently I can't. So maybe that's a
It
good thing. But anyway.
is a good thing, trust me. Yeah.
So with that being said, why don't we go ahead and jump right in? Again, ladies, the important thing for me to be able to bring forth today, as I mentioned, were signs, symptoms, things we can look for. I don't know if it's just as easy as saying, yeah, that person is, manic depressive, or that person, by their appearance. I know that it's a behavior behind it that's an identifier. Could either of you, and feel free to speak on the majority of things that you'd like to speak on, just to enlighten me, because I'm not an expert. I know you ladies are. But what are some things that we could look for, just to kind of know that we need to ask that person, do they need some help or do they want to seek some help? So again, I'll give the floor to you if you don't mind.
I'm gonna go ahead and let Pam kind of lead the conversation
Hmm.
because she actually is the mental health expert
Okay.
and oversees a mental health what would you call it?
It's a nonprofit.
A nonprofit organization.
Okay.
So lead the way.
Okay, great.
Okay.
And
So
please also tell us what the nonprofit's name is as well.
Yeah.
it's Kennedy's Council. It was started in honor of my brother who was diagnosed as paranoid schizophrenic. And he passed away 4 years ago at the age of 40.
My Lord.
And
I'll
so,
put the do you have email or something you want to put in the chat?
yeah,
Okay.
it's
Or we can do that at the
yeah,
end.
Yep.
we'll do it at the end,
Okay.
Hmm.
kennedy'scouncil.org. But what I like to for you to know as a mental health first aid instructor, which means I go out to communities and churches and educate our communities and others on what to look for when you are encountering others in your family, maybe friends. So if you've been around someone and you've noticed that their demeanor has changed, their affect, which means their facial expressions don't match what's coming out of their mouth. They're telling you they're okay, but you can see that they are disheveled in their appearance or they're just not coming to events the way they used to attend events. Then ask the hard question of, is there something going on? Is there something that you would like to talk about? And even if they don't want to talk about it at this time, you've opened the door for them to come back to you and say, "Hey, I remember you asking me if I'm okay." Well, I'm not really okay.
Mhm.
And they will be able to tell you and let them know that it's a safe place for them to speak about whatever's going on with them. That you're not
Hmm.
going to gossip about it, you're not going to tell anyone else about it, that they're safe here with you. And after that happens, then we do have some resources that we can give you that's local in Lee County. We have the national resources as well. I did a search this morning before I came on live. There are not many people that know about the crisis line that they can call for suicide ideations. And that's really important in all communities that people know where they can get help. So that's where I want to begin.
That's good.
Well, that's a great
But
beginning.
and that's a heck of an introduction. I could just say in terms of Tanya and I basically had this conversation, like she said before. We wanted to be very intentional with respect to the topics that we cover. And so again, I work with two phenomenal ladies that are nurse practitioners at the place that I work, and Dr. Wilkes being one of them, and Marilyn being the other. So I had opportunity to talk to Doc and say, "Hey, Doc, would you be willing to come on and again just bring some expertise?" She said, "I know somebody who would be perfect for that." And so again, as God
She's
actually leads us, as God
perfect.
leads us, again, I can't take the credit. I asked her and she asked you. So that was definitely a wonderful introduction. So I'm with Tanya. We're going to go ahead and let you ladies lead this. Um, and hopefully I too, not hopefully, I know I will, because I already learned something in an introduction. I too will learn something being a licensed social worker that I can possibly take with the people that I deal with, because again, it's something that young, old, it affects us all. So
Exactly.
yes, ma'am, you have the floor. Take it away.
So just know that our mental health is important to just as important as our physical health. And if you cannot think to put on your clothes or to complete daily activities, such as brushing your teeth, then it's very hard for you to make big decisions about life. So know that self-care is important. That's a big thing for me. They laugh at me all the time because if you know me as a person.
I think, did we lose the audio? Charlie, can you hear
I
me?
hear
I
you.
I
Can
can
you
hear
hear
you.
us?
Go ahead.
Okay, now we can hear
Okay.
you. Go ahead. Go ahead.
Yeah, I'm going to practice self care. That may mean eating a good meal that costs a little bit more than what I would spend usually on a meal. So, those things contribute to being a holistic person, being whole in yourself. So, after that, know that we are not here to diagnose people. So we may notice signs and symptoms. Maybe someone's sluggish in the way that they're talking to you. Maybe they are isolating themselves, because sometimes when people are depressed and just not feeling up to dealing with, I guess, life situations, we tend to isolate. And isolation is not the best thing to do, because who can help you if we can't even see you?
Mhm.
Yes. So if
Mhm.
you can, as I said before, create that safe place for someone to come and talk to you about their problems, their issues, then that's the main thing that we can do. And just notice people around us. I know when people come up to me and they say, "How are you doing?" I'm like, "I'm okay."
Automatic response.
Yes. Take it a little bit further and say, "Really, I've noticed this." Or I've noticed that you haven't been coming to family dinners.
Hmm.
Have I done something to offend you, or is there something deeper than that? And as you've established those, that open door, they are more likely to come and talk to you about what's going on in their life. And that's really what they need.
I think that
Sometimes I was
one
just
thing,
thinking too, a person's appearance can tell you so much. So you can talk to them on the phone, but if it's a way for you to actually see them, I mean, I've had friends and family and I see them and they've gained a lot of weight or they've lost a lot of weight.
Yes.
Or there's somebody who always is made up and looks, well put together and then all of a sudden they don't.
Hmm.
Those are signs that something may be off
hmm
too.
hmm
And
I think that you'd mentioned, and I apologize, and I forgive me for having interrupted. I think one thing that you'd mentioned was to extend yourself.
yes.
Hmm.
When you're talking to people, extend yourself beyond. It's not about you.
Mm-mm.
Extend yourself beyond yourself, and ask leading questions,
Yes.
probe, learn more. And I think part of the problem that I think a lot of us fall prey to is that we think someone's being nosy.
Yes. Yes.
So again, something I just said about 20 minutes ago to my friend on the phone, part of the problem is that if someone were to come and ask you those questions, and you can look at them and say, "You're just being nosy. Why are you in my business?" Blah 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 blah. Although there's suffering in silence.
Right. But when they come to you and they say that, then you respond with, "I'm coming from a place of caring. I'm not trying to get in your business, but I do care
Mm-hmm,
for you. And I've
mm-hmm,
noticed these things.
mm-hmm,
Is there any
mm-hmm,
way that I can help you?" Because if
mm-hmm.
I know that you're coming from a place of protection and a place of encouragement for me, I'm going to be more likely to speak with you. I
Absolutely.
tell my I tell my students all the time to make a list. The first day of class, when they come in, I ask them to write down 5 support people.
Hmm.
And they look at me like, "Why are you having me do this?" You need to have a list of people that you can call that will not
Hmm.
judge you based on what you're telling them, that they can come and get you when you're the worst at your worst. So if you have 5 people that you can call, because when you're in crisis, You cannot sit down and try to write down who can you call and think of who you can call. Have those people available so that if you truly need them, you can pick up the phone and call them. And those are people that you can be yourself with. Sometimes we have to put on a face, or we do put on a face when we go to work and we are encountering others, but these are people that you can be truly read with, and you can be you can be who you are with. So that's what one thing that I would do. So if you are on this if you're on this chat, please make sure that you find those people that are trustworthy in your life, and you write down those people and have them on hand in case one day, we never know, we may be in crisis and need those people.
Absolutely.
I think it's
Something else.
important to add
Great.
on to that too, that a lot of times those people may not be the people who you might assume they should be. Like, for example, if you know that your parents or your sibling is not always best in a crisis, then that may not be the best person for you to put down on that list. Now,
Hmm.
person may be very important to you and you may love them with all your heart, but that doesn't always mean that that's going to be the best individual for you to call when you need
Absolutely.
support.
Absolutely, absolutely. The other thing that I had said to my girlfriend, her name is Rose, by the way, so I know you'll watch this at some point. Shout out my girlfriend Rose. Earlier this morning was, again, she has background, she has history, educated, and I appreciate that. But the one thing I did say to her was not just people will cut themselves off to say someone's coming and asking me questions, they're being too intrusive.
Mhm.
But at the same time, I said, to me, it has to start with self. The
Absolutely.
individual that is going through crisis has to want the help. And
Yes.
some of the problem is they haven't identified that there's a problem.
Mm-hmm.
Whatever their normal is, and for whatever it is that they might be struggling with, whether it's manic or whether it's schizophrenia, whatever it might be, they haven't decided for them that they're ready to get help. So now
Correct.
here we come, as you ladies are saying, in the spirit of love and caring and really wanting to help, but yet they're looking at you saying, "Boy, ain't nothing wrong with
Well,
me."
Right.
Tanya, not to cut you off, but
Mhm.
one of the things that I've also encountered is maybe they don't know that they're even in.
Absolutely,
So,
absolutely. Yep.
again, for
But
each
if that's
person,
their normal,
well,
but
exactly.
that might be their normal.
Be their
Hmm.
normal, but
Yeah.
each person pretty much sees things differently. So, for
Yes.
example, it's raining here in Columbus, Georgia.
Hmm.
Mhm.
But if I have a mental challenge and I walk outside and I see it's sunny, there's nothing you can tell me to convince me that it's raining.
Correct. Correct.
Absolutely.
I will see the world the way I see the
Correct.
world.
Yes.
So, like I said, that's one of the things. I'm glad you brought that up. But that's one of the reasons why when Pam started talking about ADLs and they start talking about other things that you need to look for, because that person themselves might not be able to
Yeah.
recognize it.
Mm-hmm.
Yep.
Mm-hmm.
Hmm.
And
Hmm.
that is especially true for people who are diagnosed with schizophrenia and other major psychiatric disorders. So they see things from their perspective. My brother, for example, he would tell my mom, "There's water coming out of the ceiling." There is nothing we could do to tell him that there was not water coming out of the ceiling. So with that, you say, "I understand that you see water coming out of the ceiling, but I do not see water coming out of the ceiling." So it acknowledges that they see what they are
Yes,
experiencing,
yes,
but I don't.
yes.
And I'm not going to continue to confirm and engage, because that would be worsening your problem. That would be adding to it. So I will tell you that I understand that you see what you're seeing, but I do not see that. And that's the same thing as you were saying with people are not may not be ready to accept help.
Mm-hmm.
Even if that is an older adult,
Mm-hmm.
you open that door. If they're not ready to walk through that door, then they know that you're there.
Mm-hmm.
If
Hmm.
there is a way that there is a significant other that you can talk to about their issues, then maybe you all can work together. If it's really a major condition that is affecting their daily life,
Hmm.
then maybe you all can set a plan together and get them to a psychiatrist, a psychologist, so that
Hmm.
they can be evaluated.
Absolutely. Absolutely. I think that, and I think I said it at the very beginning, we all have our own challenges.
Oh,
Every
yes.
last one of us, to some varying degree. No one is without some type of challenge and or stressors, whatever. It's just a question of what the trigger might be.
Mm-hmm.
In certain cases, unfortunately, some of us, the challenges that we have are much more severe, but we all have
Yes.
them. We all have stress of paying bills and, how we going to do this or da 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 da, and you don't know what's going to manifest out of them.
Right.
So now,
Mm-hmm.
I don't know if either of you could answer this for me, but would you say that mental illness is hereditary?
There has been research performed that says mental health, there is a hereditary and a nature environmental influence as well.
Hmm.
So it really depends on what the disorder is that we're speaking about, but there is a significant component of genetics that interplay with the environment. You may have someone that has a predisposition or several risk factors that will lean towards depression, that will lean towards anxiety, and
Mhm.
then something happens in their life, maybe a divorce, maybe kids leaving for school, and they're not ready for them to leave, to go off to school, to leave them home with that significant other that they haven't talked to in 20 years. And now you leaving me with this person. So that
Real
may
talk,
be a
Whole
trigger.
different
real
pod for a different day. Different pod for a different day.
talk. Yeah,
We'll talk about that later this year.
real talk.
So it could be something that triggers, even though they have that predisposition, that risk factor, and something will trigger them to develop that. And a lot of times that happens even with students when they come to college and they've left that protective environment of their parents, and then they've got to study for tests and they got to pay their own bills, and they don't have someone to say, "Oh, it's okay. It's okay. It's going to be fine."
Mm-hmm.
Hmm.
And then the
Hmm.
anxiety just continues to rise. So, yes, there are a genetic predisposition that could occur. It just depends on what the disorder is
Okay.
and what that person has been experiencing.
It's
And
making me
Okay.
think about a particular patient that I've seen before that had several mental health diagnoses, and they had a family member to come in, and they were like, all of this person's sisters and brothers, there's 7 of them, they all act the same way, but none of the others are diagnosed. They're
Mm-hmm.
out and they're able to be out in the community and this, that, and the third. And even talking to them, they'll say, well, mom used to have to go off to a hospital sometimes for a little while, and then she would come back, but nobody knows why, nobody knows what happened, and so I think in our communities too is really hush hush, underdiagnosed, misdiagnosed, all that kind of stuff too.
and and and,
And
and I'm glad
go
you
ahead.
because one of the other things that I know, again, this is the check-in that we have. My good friend Tanya, my peanut butter and jelly buddy, and I, and we have our 2 special guests on to really talk about mental health and mental health awareness. One of the other things I'm glad you mentioned that, Keisha, is that the stigma. And,
Absolutely.
and there are certain stigmas that do impact certain communities. Now, again, mental health being one of them, and even in terms of putting mama and daddy in assisted living.
Mm-hmm.
So there are certain stigmas that are attached to the way culturally we've been brought up, and so people are fighting these because of these things. They do become stigmas, and so we don't talk about them.
Mm-hmm.
Right.
So we would much rather, unless we happen to encounter them, like she was just giving the example of, we don't know, and we will never know.
Right.
But
Mm-hmm.
Right.
it's okay for us to talk about, and we talked about this last week or last month on our check-in. It's okay to talk about, yes, I have prostate
Yeah.
cancer, or I'm a prostate cancer, I'm a survivor of breast cancer. We can speak about those things now without the stigma, but when it comes to mental health, the stigma is still there, and especially in our own community.
Mm-hmm.
And I say
And it,
this, and I just said the last point, I say this because being a therapist, certain communities see therapists as a value added benefit.
Mm-hmm.
So they
yes.
will be at parties and say, yes, you know what, I'm going to talk to my therapist about this on Monday.
Yes.
And the crowd will say, you know what, I think when I see mine on Wednesday, I might bring that up. But in our
Exactly.
community, it's, oh,
You
no, 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 no. Shh.
see a therapist?
Yeah.
Got you start.
Let the game of telephone begin.
Yes,
Yeah.
yes. But
But but
that's
but
what
but I'm sorry. Go ahead. No, go ahead, please.
But that's what this is for. It is to educate our communities, to let them know that it is okay to seek therapy if you need to seek therapy. It is okay to talk about what's going on the inside that people can't see on the outside.
Mhm.
It's important to decrease that stigma. And that's why I started a nonprofit. Because once people decide to get help, there are barriers to care, especially in our
Mhm.
communities. There are barriers to care. So people need to know, okay, if I need a taxi ride or Uber, we're in the Ubers now, an Uber to an appointment, I can go to this website, I can talk to this person, and they will provide finances for me to get to my appointment. We do not use the C word. I call it the C word. We do not use crazy because that is part of the stigma. And it's okay for people to say, oh, I have anxiety. I'm having anxiety about this. And they throw around OCD. That's not one that has stigma either. But people do not want to say, I have mood swings. I am manic one instance. I'm depressed the other instance. I have I was attacked or have trauma
Mhm.
from an event.
Mhm.
And because I visit this certain place or facility, I'm triggered
Triggered
just by the presence of being at that facility.
smells.
And that
Mhm.
happens. So we have to educate people that it is okay. It is all right to talk about what's going on up here because it may have a connection to here why you can't hold relationships, why you are not close to family members, why you can't keep friends. So, and it eventually, and what I talked about at the last event is it causes dis-ease.
Mm.
Dis-ease.
Mm.
So if you have dis-ease in your life, it leads to disease.
They out there. Oh,
Even though I can't see him, I'm over there. I know he's over there getting it. So yeah.
yes, I am.
And this ease accounts for a lot of our comorbid conditions
Yes.
that occur with mental illness. You see the people that have the diabetic, um, and that's what happened to my brother. He had got an abscess because he was diabetic. He
Mm,
couldn't take care of it because he couldn't think clearly, and
Mhm.
it eventually caused him to become septic and pass away.
mm,
These
mhm,
are things that could have been taken care of if he could think think
mhm,
rationally.
mhm,
So we do have to take care of that mental aspect because it affects our physical aspect.
mhm, mhm. Yeah, that's good.
Yes,
That's
yeah.
good. Chuck,
Excellent.
go ahead, Chuck,
No,
please.
excellent. Yeah, excellent.
What, Chuck? I was actually going to hand the floor to you for half a second.
Oh,
And just
I don't need it. I'm done. I'm here taking class. Like the comedians say, taking class. Yeah, I'm here taking class. I'm on the front row. I'm writing it down.
Chuck, I did want to know, did you
Yes.
have a question possibly that you wanted to bring forth?
No, basically, I mean, again, no question. A part of me basically is to talk and bring out
Mhm,
the good
mhm,
things that I don't need to ask the questions because she's voluntarily. What was her
mhm,
motivation?
mhm,
What started?
mhm,
Why is she passionate about what she's passionate
mhm,
about?
Yes.
Because that's the
mhm,
foundation of everything. And when you're
mhm.
passionate about something, you will encounter in life, you will encounter those
Yes.
setbacks.
Yeah.
But your
Yes.
passion has to be stronger than the setback. And so
Mhm,
Absolutely.
she's being transparent with us to share with us where it came from, why it came,
Yeah.
what she's doing about it. So again, I'm in class.
Well,
fair,
well,
fair. Please go ahead.
I appreciate both of you all for allowing me to discuss mental health. It is my passion. It is why I think I was put on this earth to talk about and to teach my students about it and the community. Um, as a mental health instructor and a mental health first aid instructor, it has given me great I don't know happiness to be
Pleasure.
Yeah.
able, yeah,
Joy.
pleasure
Joy.
to go to
Absolutely.
churches and to talk to people, just to let, because we hear pray about it.
Mhm.
I understand you going through that. Girl, just pray about it.
Mhm.
Well, I'm going to pray about it, but I need to go see my therapist on Wednesday, just like Red said. I'm going to go talk to her about what's been going on, and we're going to pray about it because she's a Christian too.
Yes.
Mhm.
So if you decide to get therapy and you find out that that therapist does not jive with you, they are not equally yoked with
Hmm.
you, then you find you another therapist. There may not be some, you may have to travel, but it is beneficial to your overall health to be able to find someone to talk to that you can't talk to your family about, you can't talk to your friends about. And they are paid to not divulge your whatever you're telling them.
So a
Mm-hmm.
lot of times our friends and family will not, they won't understand. Like, I'll give you an example, speaking freely about myself. I told my father that I see a therapist. I told him that I have anxiety. I told him that I take a medication daily for my anxiety and that I have to see my therapist. And he was like, what do you have to be anxious or depressed about? You got everything. You got a degree, you got a house, you got a husband, you got children. There's what more could you
I
want?
mean,
You
you
know?
just said it all right there.
We're not
And I
That
was
within
like,
itself.
well,
on. We're
why
not.
do you go see your endocrinologist? And he was like, what do you mean? I said, why do you go see Dr. Malika? He was like, because I'm diabetic. I said, okay, that's why I go see my therapist, because I have anxiety. I just do. There's not a, I mean, why are you diabetic? Is that a question for me to ask you? You know?
Good, good point.
And it may be past trauma. It may not be your present
Mm-hmm.
state that's causing the anxiety. It may be some unresolved issues
Mm-hmm.
that you've had from childhood that were not talked about,
Mm-hmm.
that are still, you're working through in your mind. And something, you may meet someone or have a situation at work, and that will trigger that to come up in your mind and in your spirit and in your heart
Mm-hmm.
that you have to deal with.
Mm-hmm.
So it's not just what your present situation is,
Mm-hmm.
it can be what happened in the
Mm-hmm.
past.
Mm-hmm.
Well,
Absolutely.
So those
I
things are important.
I think it goes back to what I was saying about people wanting to seek the help. You have to be in a position to want to acknowledge that there is a
Hmm.
problem, and then to be able to seek help. Now, with that, because you ladies mentioned, I actually work in pharmaceuticals, the pharmaceutical industry, so legal. I work in big pharma. Maybe I better say it like that.
Yeah.
Anyway, and so I deal with various medications all the time, and specifically clinical trials. So I'm curious the importance that we can talk about of not just seeking the help, because this is a resources. I'm leading into resources.
Right.
Uh, there's I have to seek help. I have to seek therapy, but the importance of therapy in conjunction with medication,
Hmm.
because I feel like a lot of people, again, it's a stigma thing.
Mm-hmm.
No, and again, Dr. Wilkes, thank you for being so transparent to say, hey, I do go because I've got these things going on.
Mm-hmm.
I've been to a therapist before. I went to a therapist before I married my current husband because I needed to go.
Right.
Mm-hmm.
Um, did I feel like I got a lot out of it? Was it value added? Not necessarily because I had an issue at the time,
Mm-hmm.
but I came out of that saying, you know what, I needed to get that one off. Okay, great. Now I can kind of know what I need to do. Oh,
Mm-hmm.
okay, wonderful. Should I have followed up? Maybe not with him, like you said. So it just really
Right.
depends. But I want to talk about the importance of therapy, yes, but hand in hand, how important is a medication or taking medications for whatever it is that you're dealing with, to help you kind of level out. Let's talk about the importance of that, because to me, that's a part of the resources conversation.
It
Seeking the
is.
help, finding the help, and then knowing that you may have to take a medication as well.
Mm-hmm.
Absolutely. So,
And
Reese,
they can tell when I don't take mine, can't you?
we can. We can. We can.
Did she have it today?
It's okay though, because we love her with or without.
Did she take it today?
She
Blink real
did.
fast if you feel like you are in danger.
So, research indicates that medication, along with therapy, presents the best outcomes, of course. But what you also need to know that if you are suffering with depression or if you're suffering with anxiety, sometimes it takes 2 to 4 weeks for the medication to get into your system to reach a therapeutic level. So don't expect that
The next
just
day.
yeah, don't expect that just because you went to a therapist and you took one pill and said in the name of Jesus be gone. It's not going to be gone like that. You have to be consistent with taking your medication, and it does take a while to get in your system.
And don't let other people get in your head with things that will happen in our community, such as, you need to leave that stuff at the altar. You need to just pray and don't worry about it, and God will take care of it. And yes, I pray that He will. But
Yeah.
also, we need a little help sometimes on this side too, tangible help.
It's just like
Well,
if you're taking medicine for hypertension.
Mm-hmm.
I take medicine for hypertension. I put any other medicine with that and take that as well. So just know that you need to take your medication and that you will see benefits. Let's talk about the side effects because sometimes there are side effects with certain medications. So you may have some weight gain.
Mm-hmm.
Okay, you may be a little drowsy or you may be a little drowsy. So if you need to change the timing of when you take the medication, just do that. But don't just automatically stop taking your medication. You need to consult your physician and say, okay, this is making me feel this way. There are a lot of different types of medications that you can be switched to, but just know that to keep at it, you can't give up on yourself. That's the yeah, don't give up on yourself. So whatever it takes to get you whole.
Let me ask you a question, Pam, and if it's too much, just tell me. But for example, with your brother, with your brother Kenny, with his diagnosis of paranoid schizophrenia, just from what I've studied, lots of people with that particular diagnosis have a hard time staying on their medication.
Absolutely.
So what do you do? What, as a family member, what can you do to help him understand that he needs to continue it no matter if he feels okay, you know?
He was not going to understand because he did not think he had an issue.
So what do you do in that instance?
And that issue, my mom had to go to court and she had to become his guardian. And he had to be mandated to take his medicine. He had to be mandated to get those shots to come in. And that's another reason why there's barriers because they have to have the travel expenses to be able to go and get their shots. So, yeah, just like Red was saying, sometimes people don't know they have an illness. And you have to take there are legal ways to help your family members get the help that they need. And if you have a loving and caring family member like my mother is, she did everything she could to help my brother get whatever he needed. The court, she would call me and they would be standing in court and he'd be telling the judge that he didn't need any medication. And I'm like, okay, mom, but you've got to let them know this, this, and this. And so he was ordered to take his med, and she had to drive him to get his med. But those are the things, the extenuating and exigent circumstances that you have to that you encounter, that you have to take that next step.
It's interesting that, and so to me, it goes back to the awareness. We have to have
Yeah.
an awareness that something is
Yes.
wrong. But on the other side of that, I like the approach that you said of, again, let's step outside of ourselves and go to the person that we see is possibly going through something that might be in the midst of an event, whatever it might be, and ask, is everything okay?
Yeah.
I just want to check in with you. You know, how are you feeling? How you doing? Because I think it's as simple as that. It starts with that conversation, and that might be what opens the floodgate.
Well, Tanya, that's actually the reason why, again, all this kind of comes around full circle in terms of the name of, our chat here, our pod, for lack of a better term. Check in with. It's an opportunity to really check in with one another. And so today is just our opportunity with the help of these two wonderful ladies to present the information for the rest of us. And they can absorb it and digest it in their own way.
Yes.
and it might be able to, we never know who we're helping today, but
Mm-hmm.
that we're trying to check in given this particular platform. We're just trying to check in with one another.
Mm-hmm.
And so what can we possibly do to make sure we're all right? Because we are our brothers and
Absolutely.
sisters.
Absolutely.
Absolutely. Absolutely. So, okay.
Well, some of the resources that are available local is the NAMI Foundation, and that's the National Alliance on Mental Illness.
Mm-hmm.
And we have a local chapter, even though it's a national chapter. There's a local chapter here in Lee County,
Mm-hmm.
and they have meetings, and they have resources, booklets, all kinds of things, pamphlets that you can pick up. Also, in Chambers County, there's Chambers County Health Services. In Auburn, there is the Auburn Psychological Wellness Center that accepts patients, and also Lee County Crisis Center in case you are in a crisis and you need some help.
And the Lifeline, don't forget that too.
Oh, yeah. Let me tell you about the 988 Suicide and Crisis Lifeline. All you have to do is dial 988, and someone will pick up and be able to talk to you about how you're feeling and what you're going through. So, those are some things that,
I didn't even know that.
Well, I mean,
those are some,
I've
glad
heard it
that you're
before though.
I'm glad that you're mentioning this because again, we have audience members from across the country, and so even as you're bringing these things out, you need to basically look forward to finding that resource in your own community. So it might be 977 in Redondo Beach, California. But I'm glad that you're talking about this. NAMI's again national, but I'm glad you're talking about these resources because no matter where you live, there are actually those type of resources in your immediate area. So
yes,
please continue.
Mm-hmm.
Thank you.
And
Mm-hmm.
988, that's
Yeah,
national,
okay.
right?
yes,
Yeah.
yeah.
Mm-hmm.
That's all across the US,
Yeah.
but depending on the country, it may be different.
And again, 988 specifically is a what type
It's
of
a crisis
prevention you said?
Crisis.
It's a crisis hotline
Mm-hmm.
that you can call for suicide and
Okay.
crisis events that are occurring in your life. So you just
Okay.
dial 988.
Mm-hmm. Mm-hmm. I mean,
And
that's good
so,
stuff. Yeah, that's good stuff. We are coming up on time. You'll see that I'll look up a little bit just to kind of see where we're at. And again, ladies, absolutely fabulous information that you're providing to us today. Chuck and I are just kind of sitting here just absorbing it all like, yeah, this is great. This is great. But I do want to give each of you ladies an opportunity to have some closing thoughts because we're somewhere about the 15-minute mark before we're going to be completing this call. But any closing thoughts that each of you might have, specifically whether it be just, the importance of the support, because again, I want to make sure we circle back around to that. Providing the support, again, whether it's family or friend, it really doesn't matter. But
right.
maybe you can kind of talk a little bit more about that as we close out for
Can
today.
I start so that you can finish and round everything out and correct what I may say
I'm
wrong?
not going to do anything.
Well,
Yes, you can start.
well, Keisha, slide over there. We want to see the whole page.
Yes.
Okay.
Slide. There
I
you
don't
go.
know why she on the
Okay.
side.
So, Mr. Red and I were talking about something that was very important to me. And it's because in the facility that we work in, we often see people with history of substance abuse and self-medicating. And it just started us to having this conversation about how one person going down that road of um, not seeking the appropriate help can affect generations to come. If you think about if the matriarch or the patriarch of the family is not well, then the family is not well,
Right.
right? Then you have children who are growing into adults who haven't had a stable home environment. So lots of times they don't know how to bring one to the next family.
Yes.
So if we see that, it's just so important to try to intervene because all it takes is one person being well to make a future generation of people who know that it's okay to seek help and be well.
Mm-hmm.
Because if not, it just spirals and it spirals and it spirals. And lots of people are in therapy today because, like Ms. Short said, things that happened 30, 40 years ago that they haven't been able to overcome and resolve.
Yes.
their life may be fine right now, but deep down inside, they're still dealing with the trauma from what happened umpteen years ago. And so people will sometimes say, oh, that happened so long ago, you should be over it by now. But what if I'm not?
Exactly.
Right.
Right?
Yes.
What
Yes.
if
And
I'm not?
it's
Yes.
okay. It's
Hmm.
Yes.
okay for you to not.
What if I'm
Hmm.
Yeah.
not? Yes.
Hmm.
I like
Yeah.
that. Yeah.
Right.
I'm sorry, please.
So that's just something that I wanted to say. If you see a family or a loved one, just think about the repercussions that that can have. That person getting help can change the trajectory of their life, of their child's life, of their grandchild's life. Anybody who is leaning on that person for support, you're not just helping that one individual.
Yeah.
So that's kind of what I wanted to leave the point of, and then I'll
Well,
turn this back to.
and really quickly, as you say that, my thought is as I asked the question about whether or not mental health is something that can be passed down, if it's hereditary. Um, Good health and stable health is something that can be as well. It's a work.
Absolutely.
So again,
It
if we
works. It takes
if
work.
we can identify something early on and nip that in the
Yeah.
bud, that can then break that quote unquote generational curse that we like to
Yeah.
talk about for
Yes.
generations to come.
Think about
So
the
absolutely.
criminals or the people who you hear about committing horrible crimes. It seems like almost 100% of the time there was something wrong in their childhood. Something went wrong, and so they didn't have the support of the adults around them, and they went down the wrong path. And that's not always the case, because some people they just do things that they want to do. But if we can prevent that from happening one time, you never know the repercussions that that can have on down
Absolutely.
the line.
Absolutely. Absolutely. If you can give me one opportunity for a second, I saw a question from one of our sisters from high school, from Charlie and I, Violet, our sister Violet. She asked a question, what if a person refuses help? Violet, we did actually talk about that not too long ago, but I'm glad that you're on, and we can come back around to that. I'm actually going to pass it over here to Pamela if you want to go ahead and kind of, as a part of your closing, discuss that as well and incorporate that with the support that's needed.
So if a person refuses help after you've extended yourself, then you allow them time to digest what you've said, allow them time to consider your thoughts and where you're coming from, and let them come back to you. Don't continue going back to them saying, hey, something wrong with you. And I see something wrong with you. Let them be able to come back to you. They know that you're a safe place now. You've identified that something's going on and you can see it, and other people may can see it too. But allow them to come back to you. On that note, I do want to end or conclude with, if you see someone or someone says, I'm thinking of harming myself, can't get off of here without saying, if someone mentions, I just don't feel like I want to live anymore, ask the hard question. Don't just dismiss it.
Mhm.
Ask the hard question. Are you thinking of harming yourself? If they say yes, do you have means
Yeah, yes.
to harm yourself? Have you developed a plan to harm yourself? And not that we have all the fixes, but we can then direct them to resources so that they will be able to get help. Because would you rather not ask the hard questions and then have to go see about someone or walk in on something and not be able to help them? You need to ask the hard questions and then be there to support them afterwards. I've had that happen in college. Friend, she told me she was going to harm herself. I went over to the apartment. She's taking all these pills.
Mhm.
I, I just thought, okay, she said she was going to harm her. Surely she's kidding. So I jumped in the car, went over there. She taking the medicine, accompanied her to East Alabama. She got the help she needed, and she's
Mhm.
thriving. Not just surviving now, she's thriving. So it may just take that little bit of you supporting that person, you asking those questions out of love
Mhm.
again, not out of trying to get in
Judgment.
somebody's business.
Or judgment.
Yeah,
Yeah.
withholding
Mhm.
judgment. That's another big thing that we talk
Mm-hmm.
about,
Mm-hmm.
is that we are not here to judge anybody. We all know that we are just as filthy rags. And
Mm.
so
Woo. Woo. Preach.
So funny.
Preach.
we we need we need to leave all of that aside. And if someone comes to you and let you know that they need help, that they need assistance in any way, even if it's financial. You may never know when you may be in that time to say, hey, Keisha, I need to borrow 10.
Mm-hmm.
So be available.
Mm-hmm.
Give of yourself. In nursing, we talk of giving self. So give of yourself
Mm-hmm.
and let people know that you are available, not to be walked on, but available to help if needed.
Mm-hmm.
Yeah,
And know that
absolutely.
your mental health is just as important as your physical health. We are holistic beings.
Yes, ma'am. Yes, ma'am.
Absolutely. Absolutely. Chuck, what are some of your final thoughts, brother? We got about 8 minutes, so you got
I,
two.
again, I would just leave. You know, I would just leave with, to God be the glory, because again, how this whole thing happened, we were talking about, again, being intentional for our check-in. Again, appropriate topic. And then for me to reach out to Keisha reach out to Pam, and us to have to culminate in this conversation that we had today. So again, I'm just going to continue to be that vessel. And thank you very much, Pam, for taking me to school, to class. Um, so I just appreciate this opportunity. So thank you for that.
Thank you.
Thank you.
Absolutely.
So you can't
Well,
see it back to you, Tanya, since you can't see me.
and back to you. So as Chuck has mentioned, this is the check-in with for the month of May. Again, May is mental health or mental health awareness, I guess I could say, month. So it was really, really important as Chuck, I'm just echoing what he had just said, that we are intentional coming into this year. I mean, again, I'll be honest with you, we actually had 10 topics already front loaded in from last year for this year already. But when we came back around, got closer to the end of the year, I had a conversation with Chuck and said, although all those topics are great and we'll definitely discuss all of them this year, it's important that we implement some other topics that are a little bit more thought provoking. And I think that will provide even greater good and help for people. As I mentioned, last month was Cancer Month, Cancer Awareness Month, this month being mental health. And we'll probably have more. I think next month we have men's health. So again, we're just trying to make sure that we are covering topics that are not just, informative, just a kind of, good time conversations, but actually have some substance, and that's really important, especially in today's day and age.
So,
So to me, sharing is
so
caring.
you
Go
said,
ahead, Chuck.
more importantly than is P. Diddy guilty or not? Yeah.
Right.
That,
Right.
Right.
that would
Yes.
never be anything that we discuss here. You can guarantee that on the check-in with, that's never going to be anything that we discuss here. If anything, like I said, sharing is caring, and it's really, really important that, as Chuck had mentioned, the platform that we have, we want to make sure that we are using it for the right purposes, and this is definitely one of the right purposes. So, again, to echo my cohort, Charlie, ladies, thank you so much. It has been a pleasure. So grateful to both of you for taking the time to jump on.
Yes.
Chuck, as always, you know, you already know without even being said. But again, this is the check-in with for May. Please make sure that you join us in the month of June. As I've already said, it's actually going to be men's health. And this will be an all-male pod that my good friend Charlie Red is going to be leading. So please make sure you tune in for that. I will not be on camera, thank goodness, so I could just sit back and let him kind of fumble about. So there you go. But again, we are on every first Saturday of the month, and we are on at 12 p.m. Eastern, 11 a.m. Central, 9 a.m. for our Pacific Coasters. We look forward to seeing all of you. Continue to interact with us in the conversation in the chat, because we do go through and we read all the conversations and we try to respond as well. And if you could think of any topics that you'd like for us to discuss, please make sure that you send us a message as well. So with that, everyone, thank you again. We look forward to seeing all of you on the next check-in. Thanks again, ladies. Thanks, Chuck. All
Thank
right
Thank
you.
you
now.
so much.
Absolutely.